I'm Mick Rach from Frechette Pathology and Stark Medical Auditing. I'd like to talk about some of the recent changes we see and how it might affect your practice. First, we're going to talk about the standard growth rate. Senate has passed this, the House passed it, and the President's going to sign it. This means that all physicians will get a 0.5% increase for the next 4 years. What it also means is that after that, in 2019, we're going to go to a value-based payment modifier. This is very interesting. This is the beginning of bundled payments. Everyone should be aware of this and be aware how it's going to affect their practice. Although you'll get a little increase between now and then, in 2019, things change. In fact, there's some CMS legislation that says in 2019, if you have 25% of your payment in a bundled payment, you're going to get a 5% bonus. Tie that 5% to the value-based payment modifier, and you can see exactly where we're coming to a bundled payment. I have to ask you, how are you going to get a bundled payment? How do you think you're going to be paid for that? Right now, all your services are paid per click or per fee for service. But imagine if all your services as a provider were rolled up into an outpatient surgery center or a hospital or possibly an ambulatory care center. If all those payments are rolled in, you're going to have to figure out how much you get out of that bundled payment. And that means knowing your margin per care or per case. That means knowing your margin per case, your margin per episode of care, and maybe even a margin per click when we get down to the bottom line. This means merging CPA data, your financial accounting data, with your billing data to get this information. It could be 5 years from now, you don't have a billing company. Instead, you have someone who looks at these numbers and provides that negotiation for you and figures out exactly how that payment's going to be paid out. We hope to be that company. We're already in place for this. We already built these models for some of our practices. In fact, we presented on this 2 years ago. Another thing I want to talk about, what's happening with Medicaid. A lot of states have Medicaid replacement plans. The state Medicaid plans are going away. So, for example, in Florida, there is no more state Medicaid. Everything's a private plan. Well, those Medicaid private plans aren't the same as the state Medicaid plans, and they don't pay the same. Be very careful when you negotiate these contracts, because this could be a pay cut that you could receive. You could lose, certain services might no longer be covered, and you can actually lose revenue on this. And it's not going to be a pretty picture if you're not aggressive on that. The final thing I want to talk to you about is shared risk. As we go forward, hospital-based physicians, a lot of them have a service contract or a Part A or a medical directorship contract. Well, those are going to have to be at risk. As Medicare runs out of money, the hospitals want to pay physician groups less for what they do there. Well, there's a way to do this where we could do a shared risk program where everyone moves ahead in a positive light. You assume some of the risk, the health system assumes some of the risk, and both parties try to maintain budget neutral. That's exactly the game plan we have in a couple different areas, and we're finding it to be very lucrative. And as we go forward, I think that's going to matter more and more. If you have any questions about these things I've talked about, again, my name is Mick Rach. You can look me up on LinkedIn, or you can reach me at my office number, 517-486-4262. Thank you.